But first, your medical minute. Colon cancer is the second leading cause of cancer-related death in the state of Idaho. Saltzer Health doctor Joel Lanz has 30 years of experience serving patients and shares advice on how we can better navigate this potentially deadly illness. Dr. Lanz, how common is colon cancer?
Colon cancer can occur in 5% of the population. You have a 5% chance sometime in your lifetime of developing colon cancer. Last year there were 146,000 new cases that were diagnosed in the United States and 51,000 deaths from it. It's the second leading risk of cancer death in the United States.
What age should we really pay attention to the risk of colon cancer and start those screenings?
The average risk patient should start at 50 years of age. African Americans should start at 45 years of age because the risk is higher in the African American population. And then patients who have family history, they need to start at a younger age, depending upon the family member that had the colon cancer.
And are there any signs of colon cancer that we need to be aware of?
No, colon cancer starts out as a polyp, which is a warty growth off the lining of the colon. And there are certain polyps that won't turn into cancer. There are polyps called adenomatous polyps that have the potential for turning into cancer. That occurs 25% of the time in patients after the age of 50. Early cancers have no signs or symptoms. That's why we want to start screening early. If an advanced cancer occurs, then the signs and symptoms could be weight loss, change in bowel habits, abdominal pain can occur.
Okay, and let's talk about this screening, which is so important. Colonoscopy, probably one of the most common, and can be one that can create a little bit of anxiety for people. But let's talk about the process, though, and kind of ease some of that anxiousness.
Yeah.
So the prep, the procedure, and the recovery, what does that all look like?
They have to be on a clear liquid diet the day before, and then they go on a split dose prep, meaning the prep is they take the night before and then the other part of it the morning of the procedure. And then they come in, we take an intake history and physical on them, then go ahead and put an IV into them, and then they come back to the endoscopy lab where we sedate them, very comfortable, and basically we do the colonoscopy, they wake up and don't even know it happened.
Okay.
So,
they're just hungry.
Right. So the anxiety, I think, among patients is having the procedure, which if a board-certified gastroenterologist is doing it that's very experienced, there's very little risk to the procedure itself.
Okay, very safe and very simple and very important that you get it done.
Correct.
Okay, where can people go for more information?
SaltzerHealth.com.
Excellent, thank you so much.
Thank you.